This audio presentation was pre-recorded and edited for brevity and clarity.
Hello and welcome to today's BrightFocus Glaucoma Chats. My name is Casey Baez, and on behalf of BrightFocus Foundation, I'm pleased to be here with you today as we discuss the latest updates on glaucoma eye drops in 2024. Our Glaucoma Chats are a monthly program in partnership with the American Glaucoma Society designed to provide people living with glaucoma and the family and friends who support them with information straight from the experts. All vision chats presented by BrightFocus are also available to listen to as podcasts on the go on YouTube, Spotify, iHeartRadio, Amazon Music, Apple Podcasts, and Pandora. BrightFocus is committed to investing in bold research worldwide that generates novel approaches, diagnostic tools, and life-enhancing treatments that serve all populations in the fight against age-related brain and vision diseases. Now I would like to introduce today's guest speaker, Natasha Nayak Kolomeyer, MD, a board-certified ophthalmologist and fellowship-trained glaucoma specialist at the Wills Eye Hospital. She also serves as an assistant professor of ophthalmology at Sidney Kimmel Medical College at Thomas Jefferson University. Dr. Kolomeyer has received numerous awards and grants throughout her career and is the author of many book chapters and more than 55 peer-reviewed publications, and serves on committees for the American Glaucoma Society, American Academy of Ophthalmology, Association for Research in Vision and Ophthalmology, and the Pennsylvania Academy of Ophthalmology. Dr. Kolomeyer is passionate about providing patient-centered care as well as refining glaucoma diagnosis and medical and surgical management through clinical research and education. Welcome, Dr. Kolomeyer.
Thank you so much, Casey, for that kind introduction. It's an absolute pleasure to be here today.
Thanks for joining us. We're excited to talk about our favorite topic, eye drops. And so just to dive in, we wanted to ask you, why would someone need glaucoma eye drops?
Great question to start with. So glaucoma drops work to lower the eye pressure. And I'm going to try to use the word eye pressure when I can, but it's also known as intraocular pressure or IOP if you're reading, some journal articles. But it's really important to lower eye pressure in patients who either have glaucoma damage or are at risk of glaucoma damage because they may have high eye pressure or other findings. So we know that many studies have shown that lowering the eye pressure can slow down the rate of vision loss from glaucoma or prevent it completely. And we know that some patients might be fine with just being on one eye drop. It might lower the pressure enough. Some might need more than one, or some might really require a laser procedure or surgery to get the pressure down. But in short, glaucoma drops help decrease the risk of blindness from glaucoma.
Thank you. And so there are a lot of eye drops out there. And what are the most common types of eye drops? And what are the side effects and benefits of each?
That's a great question. So there are many types of glaucoma eye drops, and I'm going to try to keep us out of the weeds here. Don't want anyone falling asleep on the call, but generally speaking, they can lower eye pressure by either decreasing the amount of fluid the eye produces or by increasing the amount of drainage of fluid outside of the eye. And by fluid, I'm going to try to use the word fluid, but we're really talking about aqueous humor, or the type of fluid that's produced in the eye. So there are a lot of common side effects that are sort of general for different types of eye drops. So they can include burning, irritation, redness, and of course, just generally an allergic reaction in or around the eyelids. But I want to go over some of the more common categories, as you mentioned, but without overwhelming you too much. So one of the more common classes are called prostaglandin analogs. So common examples include latanoprost, which is referred to as brand name Zalatan, or I use Velpros. For example, bimatoprost, which is also Lumigan, travoprost, which is Travatan, tafluprost, which is Dioptan. So they work to lower eye pressure by improving the drainage or the outflow. And these drops, at least in the United States, they usually have a blue, green, or a teal cap, and they're used once in the evening. The side effects can be, as I mentioned before, the general redness or irritation. but also can be more eyelash growth or sometimes eyelash growth in the wrong direction. Sometimes also discoloration or darkening around the eyelids. And rarely it can cause darkening of the iris or the colored part of the eye. But generally speaking, these are pretty well tolerated, low-risk medications, and oftentimes the first class of medications that we're using in a majority of our patients, but that can certainly vary. And then I wanted to mention the last few years, a related prostaglandin analog has been developed that's called latanoprostene Bunod or Vyzulta. So it works similarly to everything I just described, but it also has an additional way to improve outflow through another pathway, and it has similar side effects and dosing. Another big class of medications are beta blockers, so most commonly timolol, but also Betaxol or Carteolol. So these drops work differently than the other ones. They work by lowering eye pressure by decreasing the amount of fluid that's made by the eye. And it's important that we try to avoid these in patients that have asthma or COPD, emphysema, who may already have slow heart rates or certain heart conditions like a heart block. Some side effects that are more specific to this might be wheezing or trouble breathing, tiredness, fatigue, depression, or as I mentioned, a low heart rate. But they can be pretty well tolerated, again, as long as we're avoiding them in patients that might have those pre-existing conditions. They can be used twice a day, but sometimes we recommend using beta blockers just once in the morning, and they can have a yellow cap or a white cap. And then the third class of eye drops that I wanted to talk about were carbonic anhydrase inhibitors. So these are drops like dorzolamide, which would be brand name Azopt, brinzolamide like Trusopt. And this class works similarly to the beta blockers I just described by also decreasing the amount of fluid that the eye makes. But they had some particular side effects, such as possibly a metallic taste that could occur in the mouth. So if you drink soda, it might taste a little funny. And they also have an orange cap, and they're used twice a day. There's also pills that are carbonic anhydrase inhibitors, but that's a whole separate discussion. And then a fourth class, if you're still awake and listening to all this, are alpha agonists or brimonidine or aproclonidine. They also work by decreasing the amount of fluid that the eye makes, but also increasing the drainage. And some particular side effects to note could be dry mouth or a dry nose, tiredness, headache, and they might have a particular localized reaction in the eye that we look out for as doctors. And they should not be used in young children, and we're a little bit more cautious in the very elderly in case there's any noted fatigue related to this as well. And there's the newest class of eye drops, which are Rho kinase inhibitors or ROCK inhibitors. This is Nartarsadil or brand name Repressa. And they work in a variety of different ways, including decreasing the amount of fluid production and also improving drainage. The nice thing about this class is that there haven't been as many systemic side effects, but they do cause redness in about half the people that take it, but some tolerate it just fine. And it's used once in the evening, and they have a white cap. And I wanted to mention there's a common older category of drops, which probably very few patients are on, called pilocarpine or cholinergic agonists, and they increase the natural outflow. And that class is less commonly used because it does have quite a bit of side effects, possibly, such as blurry vision, headaches, or brow aches. And in some people, it could increase the risk of a retinal tear detachment. So those are the general categories. And I did want to also mention that in the United States, we have several combination eye drops. So the four common ones are timolol and brimonidine together, which could be brand name Combigan, timolol and dorzolamide together, which could be brand name Cosopt, or brimonidine and brinzolamide together, brand name Simbrinza, or Natarsadil latanoprost together, brand name Rocklatan. So some of these are only available as brand name, but the first two I mentioned are also generics at this time. So I think it's nice when we can have patients on a combination medication, because then they're carrying around just one bottle, and they're getting more for each drop that they remember to put into their eye. And there are also compounding pharmacies that might carry other combinations, but that's not something that I routinely prescribe for my patients. So that's, I think, a good overview, but there's great information online, including on the BrightFocus website, that might have more details if you're looking for more.
Wow, thank you so much for that detailed information. There really are a lot of options when it comes to eye drops. So of course, it's always important to consult your doctor. And so you did mention some side effects related to these different types of drops. Are there any techniques to minimize or prevent side effects from glaucoma eye drops?
Yeah, that's a great question. So the biggest one that I recommend is called punctal occlusion. And this is something, I definitely recommend you Google or try to see if you can find a video of this as well. I'll try to describe it in words, but you can close your eyes and use your finger to put some pressure on the inner corner of your eye because that's where the tear drainage system is. So by applying pressure in that area for 1 minute after putting in your eye drop, it'll decrease the amount of eye drop medication that's leaving through the tear drainage system. And why is that important? Because it allows more time for the drop to be absorbed by the tissues around the eye. So maybe you'll have more effectiveness. And also it makes it less likely that the eye drop's gonna drain quickly into the nose or eventually into the bloodstream. So there's less likelihood of side effects, around the rest of the body. So again, just try to see if you can look online for a picture of that, or I know, again, the BrightFocus website does have some information on that. It's important to make sure you're not poking your eye, that your eye is closed during this time, that you're not putting pressure on the soft part of your eye, you're just putting pressure on the bony part of the inner corner of the eye. And if that sounds too complicated, you can also kind of close your eyes a bit more tightly than usual for about a minute after you put in your eye drops, because that also closes off the tear drainage system. And so it achieves the same thing. So that's described as punctal occlusion, if you want to look that up. One other thing is, patients are oftentimes complaining about the redness around the eye, or I see the streak of red, I can see that they're having sort of a reaction right underneath their eyelid, but actually the eye itself is tolerating the drop fine. So it is important that we remember to avoid the eye drop running down your cheek or your eyelid. So have a tissue ready so you can dab that away. Some people who have very sensitive skin actually apply Aquaphor or some other, ointment, not in the eyelid, but on the eyelid or on the cheek to prevent any absorption of that drop on their skin. But those are people who are very, particularly sensitive. And then I wanted to mention, it's really important that sometimes what we think about as side effects from medications are actually side effects from the preservatives. So most drops have preservatives in them, and the preservative in each drop is not in each different medication bottle, it's not the same, but you may be sensitive to a preservative even more than you are to a medication. And the more medications you're on, like maybe you tolerated one preservative and one medicine, but now your doctor started you on another one. So we know that more medication and more preservative burden can increase the amount of side effects, more redness, more irritation. So it's important to see if you can get a preservative-free option. Talk to your doctor about that. Some of the medications I described, some have preservative-free options, some don't. But certainly there's some changes that your doctor might be able to suggest. And in general, if it's just some intermittent irritation or redness, I encourage you to use some artificial tears, because glaucoma drops and their preservatives do induce more dryness. And so getting over-the-counter artificial tears, you can put in those drops, oftentimes 4 times a day, but using it more often, it's important to get preservative-free artificial tears. And again, anything you're putting into the eye, you want to wait at least 5 minutes between either any eye drop medications or any artificial tears and the medication to make sure that one is not washing out the other.
Thank you for those wonderful tips. That's really helpful. Our next question is, are there risks to using eye drops if you have been diagnosed with other diseases? Who should not use glaucoma eye drops?
That's a great question. So started mentioning earlier about beta blockers such as timolol, so they can affect the lungs or slow down the heart rate. So people with active asthma or COPD, lung issues, or who already have a slow heart rate should avoid beta blockers, or if you're not sure, you can talk to your doctor, your cardiologist. But of course, with everything that I'm discussing, you don't want to make any big changes without talking to your eye doctor first. And then another thing is prostaglandin analogs. I mentioned early on, they're pretty well tolerated, but in certain cases, like patients with active herpes infection in the eye, we would tend to avoid that, or in very particular cases of macular edema or swelling in the retina after cataract surgery. But again, this is usually something that your eye doctor will be taking into consideration. And alpha agonists like brimonidine, one, avoid in children, babies. And then in general, I would say alpha agonists and beta blockers, they can cause dizziness, tiredness in anyone, but it's certainly much more likely in children and in the elderly. So if it's happening and you're not sure, and this happens sometimes with my patients, I usually recommend that they do a trial without that drop and see if they're feeling better. And sometimes sometimes it is the reason, sometimes it's not. But again, this is something definitely to talk to your eye doctor about if you suspect you're having a side effect such as that. And then, of course, there's alternatives to any of these drops. So we don't want to be torturing our patients with these side effects or these risks if we have other options, which I'm sure we'll get to later on.
Thank you. You mentioned a way to try and lessen the side effects from the glaucoma eye drops. Do you have any other advice on how best to use glaucoma eye drops, or what to do if someone has a tremor or trouble squeezing or aiming the drops into their eye?
Yeah, that's a great question. I wish we had video capabilities because we're going to do so much, but I am happy to try to discuss some ways to get the drops in. So, but if my words are not enough, I really encourage you. There are some great videos online, again, including on the BrightFocus website. But I usually recommend that patients use their non-dominant hand, so oftentimes the left hand for many people, to pull down the lower eyelid, and then use their dominant hand to place the eye drops into what we call the pocket, which is when you pull down your lower eyelid, there's that space between the lower eyelid and the eye socket. So that's where we want you to aim for the medication, and you can rest one hand on top of the other if that helps to stabilize things. And you want to be careful. You don't want the tip of your bottle to touch your eye or your eyelid, because then that's going to contaminate it, and we don't want you to get an infection because your eye bottle, your medication bottle is contaminated. So you just need part of that eye drop to make it in. I wanted to mention that the eye drop is a much bigger volume than what the lower eyelid pocket can really hold. So even if you aimed in the right spot, it's very normal for part of that to roll away. As long as some of it got in, that's fine. And as I mentioned, it's good to dab away the excess. Now, some people like to do this while they're looking in a mirror because they feel like they can aim and get it in. But then, there's a little bit more of a risk of things rolling down without getting into the pocket. So usually I recommend that you look in the mirror to make sure you feel like you're in a good position, but then roll your head back so that gravity is on your side and you're more likely to get the drop in. And some people actually prefer doing this while completely lying down. But if you are having trouble, I do recommend, if you have somebody around, ask a family member or friend. Again, if they feel a little queasy about eyes, just let them watch a video as well. But it is important that you get the drops in consistently. Some people like to also refrigerate eye drops because then they feel the cold getting in and they feel reassured that some of it has gotten into the eye. And then you also mentioned, I believe, a tremor, or some people have trouble squeezing. I honestly have trouble squeezing some drops out of the bottle as well, especially towards the end of the bottle. So this is not uncommon. I think people should know that this is certainly possible. There's a lot of eye drop assistance devices that are available, and sometimes they help with making the squeeze, allowing the squeeze to be less powerful, or they also help with people with aiming in the right spot. So I encourage you to look for these options online on Amazon or Walmart or in person at various pharmacies. I've also been told if you're a veteran, you can get these through the VA. So I think that this is certainly something that I wish more of our patients knew about, that there are ways to improve the likelihood of getting your drops into your eye. And if all of these things don't work, then again, I think it's very important that we have a transparent conversation, patient to doctor, so that we can navigate this further and look for alternatives.
Thank you. Our listeners would like to know some things related to timing. And so, does it matter what time of day I use my drops? And what if I can't remember to take my glaucoma eye drops? There are some questions we have regarding timing.
Great, yeah. So timing does matter. So I think it's important to balance what is the ideal timing for an eye drop with also what makes it most likely that you're going to get the drop in consistently every day. And we can't always achieve both. But it's important to kind of balance both of these ideas. So prostaglandin analogs and rho kinase inhibitors, like latanoprost, vimatoprost, or Ropressa, these ones are both once in the evening. And sometimes they're written out as or defaulted to once before bedtime. But I find that a lot of my patients forget to take things right before they go to bed. They fall asleep on the couch, then they're rolling into bed, and then they just forget and they remember to take it in the morning. So rather than that, I would prefer for patients to take it anytime after 6 or 7 p.m. in the evening, if that means you're going to be more consistent with it. But they are better placed in the evening, and there's two reasons for that. Number one is because studies found that they're more effective that way rather than in the morning. And number two, because they do both tend to cause some redness, and if most of that redness is occurring while you're asleep, then it's less noticeable when you wake up. So, but obviously discuss this with your doctor. I have people who work night shifts, and I think there's no right or wrong answer, but I tend to just have them use it after their shift and things like that. So an important thing to discuss. And then I think there were some questions about timolol or the beta blockers, whether they should be used in the evening or not. So timolol works by decreasing the amount of fluid that the eye makes. And the eye makes the most fluid, we think, in most people, at least early in the morning. So for a drop like timolol, it's most important for it to be placed in the morning. And a study did find that there was no big difference in putting it just once in the morning or twice a day for most people. And so I actually, personally, what I tell my patients, which is not maybe what your eye doctor will tell you, everybody has a slightly different situation, but for most of my patients, I recommend that timolol just be used in the morning and to avoid the evening dose, because in this scenario, it could also be doing some harm in a very small subset of patients, because it can also lower your blood flow around the eye, and that's a little bit more of an issue overnight. So in people who have low pressure or normal tension glaucoma, we may want to avoid using the timolol in the evening. But again, this is a patient and person and physician-specific question, so definitely want to make sure you discuss that with your doctor. And then the other ones that are twice a day or 3 times a day, like bromonidine or the alpha agonists and carbonic anhydrase inhibitors, or like dorzolamide, brinzolamide, they can be prescribed twice a day or 3 times a day. We know people are much less likely to use things when they're prescribed 3 times a day. So I tend to not recommend that. Twice a day means, usually early in the morning and then again in the evening. So if you can do that with your meals, then that's great. But one thing I did want to mention, especially if you're on more than one eye drop, it's important to space out your eye drops. So I know everyone's in a rush to get going in the morning, but if you're on 2 different eye drops in the morning, you should wait 5 to 10 minutes between them to avoid washing one drop out with the other. And then I know you mentioned, what if we can't remember? And I can totally sympathize with this. Life is busy, it's hard to keep track of things. So whatever you can do to make this a part of your life, the more likely it's going to be. You don't want to make it hard for yourself. So if you're really good about brushing your teeth twice a day and you're on a twice a day eye drop, then maybe keep it next to your brush and make sure you do your drop first before you brush your teeth. Or if you eat meals consistently at the dinner table, then you remember to do it before you eat your breakfast and dinner, or before you get your cup of coffee, or just try to bundle it. Or if you're already taking other oral pills, try to keep your eye drops there. And some people think you have to put your eye drops in the fridge, and that's not the case for most medications. For the prostaglandin analogs like latanoprost, it says that, but that's for unopened bottles to keep them fresh while they're not being used. But again, double check with your particular medication, but people sometimes forget because they feel like they need to keep it in the fridge, and that's only true for a very particular subset of medication. So I tell my patients to be bold, place sticky notes wherever they need to on the fridge, or involve their family. But I have to say, I recently had to take an antibiotic 3 times a day, and I did horribly on the first day, despite, knowing these little tricks. So then I asked my iPhone to set a daily alarm for me to take it 3 times a day, and that really worked. So, and I knew I was going to be doing this little chat, so I just wanted to see how easy it was. And actually, I just, asked Siri to set a daily alarm, not a reminder, but an actual alarm to place an antibiotic at 8 a.m. And it did it for me, like real quick. I didn't even have to go to any of the screens. And then I asked it to do it for me again for 1 p.m. and then again for 7 p.m. So in less than 30 seconds, I had a daily alarm for those 3 time periods. So I know not everybody has a smartphone, or not everybody feels comfortable using it, but if you can just take the time to set an alarm or have a family member do it for you, I think that's one additional way to just remind yourself or have a nice checkpoint about it.
I love the iPhone alarms. They're so helpful. Our listeners want to know if these glaucoma eye drops are something they have to use, for life, which sounds kind of intimidating. Are there any alternative treatments?
Yeah, I mean, I hate to say, oh my God, you have to use this for your whole lifetime, because that sounds depressing. There are definitely other options, and we'll go over those. But yes, if you don't use them, they don't work, right? So my patients initially, when they're just starting out treatment, they may think, oh, well, I'm going to use this for a month and then I'm going to be better. But the eye drops we're talking about, they really only work while you're using them. So if you miss them for the weekend because you were traveling, then your pressure probably went up during that time period. So try to avoid those periods where you're missing them. But there are some great alternatives, and this is something that's going to continue to expand, and it's something so exciting for our field. So one big thing is selective laser trabeculoplasty, or SLT. It's a type of laser that's in the office. It's very commonly used. It's not an option for every patient, but it's a very good option, especially early on in open angle glaucoma patients or those with high eye pressure. So this is a laser that stimulates our natural drainage system of the eye and encourages it to work better. So it can bring down eye pressure in about 75 to 80% of people. And the good thing is that this laser procedure comes with very little risk. There are risks, but they're very, very small. So if you've not had this laser yet, I would certainly check with your doctor if you're a candidate, because not everyone is, but it is a good, safe option. And then, of course, there's a variety of surgeries that can also lower eye pressure by improving the natural drain or creating a whole alternative drain to lower eye pressure. So these could include goniotomy, trabecular meshwork devices like the iStent, trabeculectomy, Zengel stents or tube shunts, a variety of different options. So again, great if you're kind of sick of your medication and you haven't talked to your doctor about it or been honest with you, I definitely do encourage you to be honest, because there are these alternatives. And then the third option is sustained release medication. So what does that mean? It means it's a medication oftentimes ones that we've already discussed before, that can be injected into the eye itself and then slowly released on its own without the need for the patient, for you, to place the eye drops into the eye. And this is a rapidly expanding field. Lots of research is going into this. So I think it's really exciting, but currently there are two options that are actually available for patients. And one option is called the bimatoprost SR, or Durysta. So it's a pellet, a small pellet of a prostaglandin analog, bimatoprost. So we discussed that category of medications. And it gets injected right in the office, and it just self-dissolves, and it can last a few months, but in some patients, it continues to have an effect over 1 year. So that's really exciting. And the issue right now, I guess, with this is that it can only be placed once per the FDA. They have not yet allowed it to be placed again. And it's not covered or not, relevant to every particular type of glaucoma patient, but it certainly makes sense for some. So that's one option that is available. And another option is called the iDose. So this is an implant that can be placed in the natural drain of your eye. And again, it emits the medication, and it can last even 3 years in some patients. But this is not an in-office procedure, it's a surgical procedure, but it could potentially last a long time. So, but again, this is actually very new, and so insurance companies are still trying to figure out how to cover this. So these are both very promising technologies, but at this point only relevant for a subset of patients. But I'm really excited that I think in the next 5-10 years, there's going to be more and more options like this as well that can be even more useful to a larger proportion of our patients. So if you're interested in these alternatives, certainly talk to your doctor about it. I think the future is bright.
That's wonderful that there are so many options. It just shows the power of research. And so just to touch on research, what kind of work is being done to develop potentially anything new that might be coming onto the market in 2024 or 2025 for glaucoma eye drops?
Yeah, that's a great question. I mean, there's lots of medications in the pipeline. It takes many, many years for ideas to become, reality. There's a lot of testing involved. So there are medications that are similar to what we've discussed, with maybe a bit of a twist, maybe a different preservative, maybe a different combination. But also, I think, as I mentioned before, the sustained release medications, there's other ways, not just injections, but some people are looking into putting a plug into the tear drainage system that could release medications, or a contact lens that could release medications, or a hydrogel, a gel that maybe you have to use less often to get the same amount of medication, or emitting medication through the lens that's implanted at the time of surgery. So there's a lot of innovation in the actual molecules, and then also how the molecules are getting to the right spot. But another part is also neuroprotection. So everything that I've sort of talked about right now is all talking about lowering eye pressure. But lowering eye pressure, we know it doesn't guarantee you're not going to go blind or lose more vision, but it does slow it down. And then for some people, it's just not enough. So neuroprotection refers to ways to stop or reverse damage to the optic nerve as it relates to glaucoma. And so there's some exciting research there, whether it's an eye drop or supplements and things like that. So definitely stay tuned for other things that are going to continue to be more promising. I wanted to also mention, I wanted to mention earlier, but I actually didn't come up, but I think someone was asking about the nano dropper, which I think is an exciting technology. It's not technically a new medication, but I encourage you to look it up, especially if you're running out of your eye drops too soon, or if you're on a medication that's pretty expensive. So this is a separate company than the company that's making the medications, but it's an attachment to the eye drop bottle, and so it can actually decrease the amount of volume that's being released every time you squeeze the eye drop bottle. And so, as I mentioned earlier, you really don't need all of the volume of the eye drop that comes out from a standard bottle. And so this nano dropper will decrease the amount of volume, but from the studies that I've seen, again, I don't have any interest in this, but it seems like it's as effective at lowering the eye pressure, and at least the studies that I've seen so far. And it may make that bottle last longer, and but it's only okay to use it once. It's like a one-time use, so it's an additional cost to the patient. But so each patient is different, whether that makes sense for the patient or not to use. It just depends on your particular situation. But I would see if that's an option for you as well. So I think it's really exciting to see how there's a lot of work being done to not just, we think about medications or surgeries, but there's a lot of also work, just generally speaking about how can we make life better for glaucoma patients, or how can we make life easier, or, and one other thing I want to talk about is advocacy. Sorry, but I'm going on forever. So it's something I feel really strongly about, that us as doctors and as you as patients or family members, we really need to tell our legislators why it's important for them to, prioritize healthcare, or what they can do to make your lives easier. So just recently, I practiced in Pennsylvania, and I think it was 2 years ago that we passed a bill that allowed and required insurance companies to refill eye drops earlier than what might be otherwise calculated, because you mentioned earlier that people sometimes run out or sometimes miss. So then my patients tell me, well, there was a whole week I didn't have my drop because I wasn't due for a refill. So look up in your state if or in your area if this is possible. But in Pennsylvania, for example, it is required that if you have an appropriate refill and everything, that instead of at 30 days, but even at 21 days, you should be allowed to get a refill earlier. But it does require, unfortunately, a lot of self-advocacy and arguing with the pharmacist in the pharmacy. But I think there's so many different ways that we can improve, quality of life and make this process easier for our glaucoma patients. So whether it's, the medication itself, or how to get the medication into your eye, or how to get the medication early, these are all different ways. And if you have other ideas, I think, we're all ears. So I'd be happy to hear from you.
Thank you so much. We have just one final listener question, and it's related to something you touched on regarding just making people's lives easier. And so our listeners want to know, why do some of these drops cost so much? And are there cheaper options when it comes to glaucoma treatment?
Yeah, what a great question. I wonder sometimes why they cost so much. But of course, I'm no expert in that area about cost, but it does take a lot of time and resources, I know, for medications to get developed. But I do wish that there were less expensive options. So number one, I think it's important to see is there a way for me to get this drop at a lower cost? And sometimes it may not be just going straight through your insurance, but sometimes it's important to just reassess and look to see that medication isn't available cheaper through GoodRx or other ways, or there might be a coupon deal. So it's important to kind of look at that online, or GoodRx is a website or an app. But for some medications, it's actually cheaper to use that coupon rather than go through your insurance. Alternatively, if that doesn't work, I think it's really important to talk to your doctor about how costly it is. So some patients think, well, my doctor must know that this new medication is $300 a month. But unfortunately, we don't. We don't have that transparency. Our healthcare system is so broken. So every drop we prescribe is a different cost for different people, depending on their insurance and their, what part of the year it is. And so it's important to just let your doctor know, hey, this is how much it costs me. This is, something I can't do, or, maybe I could if you feel like this is really the only option. So just be upfront with doctors. And sometimes we can do a prior authorization if it's costly because the insurance company didn't cover it, or sometimes we could do a tier exception, which means that, we're arguing that you should have to pay less for it than what the insurance company is requiring at that point. So there are different ways that we can work together, but it's, certainly it first starts with a conversation about how expensive it is, and then knowing our alternatives and working together on that.
Thank you so much for that incredible wealth of information. Self-care and taking care of yourself when you've been diagnosed with glaucoma can be incredibly challenging, and we're so excited that you have joined us and our listeners today to provide all this amazing information. And to our listeners, thank you so much for joining our Glaucoma Chat. We sincerely hope you found it helpful, and as our time together ends, we'd like to get your feedback. We'll be taking a short break during August, so our next Glaucoma Chat will discuss glaucoma treatments on Wednesday, September 11th. Thank you so much for joining us, and this concludes today's BrightFocus Glaucoma Chat.
The information provided in this recording is a public service of BrightFocus Foundation and is not intended to constitute medical advice. Please consult your physician for personalized medical, dietary, and/or exercise advice. Any medications or supplements should only be taken under medical supervision. BrightFocus Foundation does not endorse any medical products or therapies.